You mentioned earlier that a lot of people that come see you in and around Atlanta wake up every morning and this is their reality. Teeth in a jar by the bed. Talk to me about that.
You know, one in 7 Americans are without their teeth. And I think it has become, you know, with people living longer and longer, you know, I think it's become a secret often in our society that, you know, really how many people this is their reality of, you know, taking their teeth out at night before they go to bed and putting them back in the morning. And we've heard from so many patients that, you know, about having to stay up later than their husband or wife because they didn't want them to see them without their teeth, or, you know, waking up early to start the whole denture routine.
Because they're even in front of their spouse, they're embarrassed?
Yes, yes, absolutely. And so it's not just, you know, out to eat or with friends, but it's just, you know, not wanting anyone to see you without your teeth, or in some cases, the spouse is not even knowing, you know, that their husband or their wife were missing their teeth.
Now, you sent us, again, out of all those cases that you sent us, I want to talk about this gentleman here. Just an amazing transformation. Walk us through what you did for this patient.
So Jim is a car guy. He recently retired, but his job was working on cars. He's one of those guys that just kind of put everyone else first and never took time for himself. And so it'd been quite a while since he'd been to the dentist. And one of the things we talked about was at his first visit was, you know what, teeth sometimes are kind of like a car in a way. You know, we can go and we can replace the transmission, and we can, you know, replace the alternator, and kind of work with the car we have.
As they break down.
Exactly, and kind of just fix thing after thing. But then, you know, sometimes, you know, what's to say that, you know, the air conditioner is not going to go out in 2 months, and then we have to replace that, and we're just kind of just, you know, I think in the past you just felt nickel and dime with constantly having to, you know, fix something. So, you know, we had the conversation, do we replace part after part, or sometimes do we just start over? So, you know, being able to take someone and, you know, maybe this had bad luck, or, you know, whether it's from feeling like they had soft teeth or genetics, or it's just been a long time, and basically rebuild their entire mouth and give them new teeth in a day is, you know, one of the coolest things we can absolutely do.
You just said teeth in a day. What?
So, you know, I always tell patients, you know, you come in with teeth, you know, or maybe come in without teeth, but, you know, we're going to make sure you leave with teeth. So, you know, really being able to, you know, wake up to having a set of teeth, you know, in their mouth while they're, you know, they can leave, they can eat, they can chew, they can smile confidently for the first time is probably one of the biggest advancements in what we can do now.
So a guy like Jim comes in here and his teeth, again, they're worn, they're aged, and he's, like you said, been nickel and dime, just fixing one thing here and there. He can come in and sit down in your chair and in one day walk out with something equivalent to a brand new smile. That's
right. So now with, you know, advancements in procedures, advancements particularly in dental implants, and, you know, even in the technology and ways that we're diagnosing these cases and planning these cases, it's absolutely possible to, you know, come in one day with your old teeth and then leave with an entirely new set of teeth that looks good, feels good, is functional.
And is it teeth that I'd have to wait a few months to start eating, you know, semi-hard foods again? Is it something I got to wait a week just drinking through a straw? Or
no.
What's the kind of healing time or turnaround time on
Right,
that?
right, absolutely. So we tell all patients, you know, I say, you know what, when you go home, you know, go ahead, let's take them for a test drive. Let's see how we do, absolutely.
Wow, awesome.